Okay, the big beautiful bill has officially passed the House and it's now going to be on Donald Trump's desk as of tomorrow. Here are all the changes that are happening to the medical and healthcare field as a result of it in 60 seconds or less. There are now going to be work requirements for both SNAP and Medicaid programs. Starting soon, adults aged 19 to 64 without a disability or children are expected to work or volunteer part-time in order to receive their benefits. Specifically, it's going to be on average 20 hours per week. However, if your children are over the age of 15, this rule also applies to you. They're going to make the enrollment period shorter and they're going to make it happen more frequently, twice a year instead of once a year like before, and you're going to have to prove proof of income as well as residency. Now, if states decide to use funding for Medicaid for undocumented immigrants, they're now going to be reducing the reimbursement rate from 90% to 80%, meaning the states have to pay more in order to have these individuals a part of their plans. And this isn't just for the undocumented immigrants, but for the entire state as a whole. Reducing the provider and hospital tax rates from 6% to 3.5% by 2032, meaning that states are going to be getting reduced funding for Medicaid as a result of this, but they're also making a $50 billion fund in order to help counteract this. Both Medicaid and SNAP, for states with high error rates, they're expected to pay higher fees, meaning that it's going to cost them more money. Pharmacy middlemen like BPMs are no longer be able to charge more than what pharmacies initially charged Medicaid, hopefully making drug prices cheaper. Lastly, programs like Medicaid are not going to be able to fund programs like Planned Parenthood and other groups, but it's only going to be for 1 year. If you want a full in-depth analysis as to what we talked about, it's going to be on my Substack today, and it's also a YouTube video today if you want more information. If you want to just help support the page, you can also find resources for that as well. I'll see you later.